the session and introduce our speakers. So firstly, I just want you to welcome to really participate in this academic online opening. So we had a ceremonial opening last night, but today is our academic opening. We have another one tomorrow. So first, the rules of engagement. Please let us see who you are. Now, use your video. If your bandwidth is a problem, you can switch off the video, but otherwise it's always nice to see the faces. It's also nice for the speakers to feel that there is some interaction. But if you're uncomfortable, obviously you can keep your video off. Keep your microphone always on mute, except if you are speaking, but please keep it on mute. You are welcome. There will be time for questions and answers. Please raise your hand, use the raise hand function. If you go to reactions at the bottom of your screen, there's a raise hand function. We will monitor that and then you can ask questions. Also, if there's questions, you can pop it into the chat box. I will also be monitoring the chat box to post the questions to the speakers later. Lastly, if you have Twitter, please be part of the online conversation and use the Twitter handle @StellenboschUSB and the hashtags #TheYearAheadUSB and #USB Academic Opening 2021. Adwa, if you want to pop that onto the screen or in the chat box for people to see, that will be great. Or Amber, if one of you can pop it in there. So please feel free to tweet #StellenboschUSB with a handle StellenboschUSB, #TheYearAheadUSB or #USB Academic Opening. So to come back to what it is about today. So our session theme is the year ahead as it relates to the COVID-19 pandemic, vaccines, and the workplace traditions. But this is fitting into our bigger theme, a new horizon, the year of recovery and opportunity. And I want to say that maybe this year, 2021, is not the new normal. 2021 is our new reality in which some things will become normal for us. Now, you know that the coronavirus has killed more than 2 million people and infected more than 100 million people worldwide. And in South Africa, we have reported more than 41,000 direct deaths, and they postulate that there's many more that was non-reported. More than 1.4 million infections, but good news, more than 1.2 million people recovered. However, I think we can all attest now to the second wave. It is much closer to home. This week alone, we in our circle have lost 3 people. So suddenly the second wave is real. There's a lot of talk about vaccines and a lot of questions. And this whole scenario of what has transpired since December 2019 worldwide has compelled many governments to lock down their populations in degrees unimaginable before to us. It's causing the most brutal recession in living memory, but it's also a time of opportunity. Some industries has flourished, but there's also the rapid development of vaccines, which at least offers some optimism and some hope. So in this new reality of us, I want to welcome all of you to be part of the conversation, and also specifically our 2 guest speakers, Prof. Portia Jordan and Dr. Natasha Winkler-Titus, which I will introduce now to you. Firstly, Prof. Jordan, we will listen to her. Then after her talk, I will introduce Dr. Natasha. And then after both sessions, there will be 25 minutes for questions and answers. But as I mentioned, if you want to put questions in the chat function, you're welcome, and I will monitor it to pose it to our speakers. So let's get into things. Prof. Portia Jordan. Prof. Jordan is the executive head of the Department of Nursing and Midwifery at the Stellenbosch University of South Africa, where under and postgraduate nursing qualifications are offered. She holds a PhD in nursing, a MBA, and specialist qualifications in critical care nursing and nephrology nursing. Her research focuses on critical care nursing, evidence-based practice, and patient safety in nursing. She has supervised over 15 master's and doctoral candidates and published in various national and international peer-reviewed journals. Nationally, Portia is an executive board member of the Forum of the University of Deans of South Africa, or Fundisa. She's a member of the Critical Care Society of Southern Africa and the Plume Research Fellow and a Fellow of the Academic of Nursing of South Africa, or FANSA. Internationally, she's a board member for Tau Lambda chapter for Sigma Theta Tua International Honor Nurturing Society, or STTI. That's a mouthful. And also executive board member of STTI Research and Advisory Council. Portia is also part of a global transformation in nursing education. She's a community of practice of nursing leaders and deans across 7 global nursing schools who focus on evidence-based practice, patient safety initiatives, and quality of care. Portia will provide an overview of the year ahead for us as it relates to COVID-19 vaccine availability and rollout. Thank you, Portia. Over to you.
Thank you, Riata, for that introduction. And I also want to thank the organizers for inviting me to this event. And it's really quite a privilege to share the information on COVID-19, a little bit about vaccines and how we're going to go forward in this year. So we heard from Renata also, just an overview of where we are with COVID-19 and the pandemic in the country and globally. So my aim is with this presentation in the next 30 minutes just to talk about the impact of COVID-19 on the different sectors and how it affects the different sectors. Then to move a little bit over and talking about the COVID-19 prevention toolbox, and then adding to that toolbox vaccines. And I'll touch a little bit on the vaccine proposed rollout plan for South Africa in particular. And then lastly, conclude the presentation with what does this year look ahead in terms of the known, the unknown, and the opportunities. And this is quite a very interesting heading in one of the articles that I've perused in saying that 2020 is the year that everything has changed. And I believe in so many ways that this is such a truth, because across the globe, we have seen that businesses have closed, schools have closed, institutions have closed, and it's quite remarkable, the picture on the left-hand side that says the globe has been closed for business. And the reason for that is that approximately a year ago, that SARS-CoV-2 was around the world introduced, and this pandemic then served as COVID-19, or better known as coronavirus disease 2019. And this was the worst pandemic that has ever been surfaced, and it's caused much suffering, unemployment, loneliness. It has really amplified gender-based violence. There was injustices, corruption, poverty, but above all that, there were innovation. And we'll touch on that a little bit later. And in terms of this year that everything has changed, we believe, looking at the statistics, that SARS-CoV-2 really had an impact, because as we can see from the statistics, that more than 80 million people were infected with this virus. More than 500 million people is probably still undiagnosed. More than 2 million people have recorded deaths, and the world economic output is at least 7% lower than it would have been otherwise reported. So let's look at the global picture in terms of the statistics. You can see from January 2020 until January 2021, where this virus was then announced globally, we can gradually see the increase in statistics in terms of confirmed cases, and this is cumulative numbers. And at the moment, as of a week ago, we see that the curve has tremendously increased in terms of our world statistics. If we take a closer look in terms of the different countries, and I've just extracted some of the countries, we can see that the United States is really heading ahead of the rest of the countries globally in terms of their statistics. India, Brazil was one of the countries that followed. And then, of course, the lower countries are countries like Australia. And this was just an extraction of some of the global picture. If we look at our daily confirmed cases within the last year, we can see that these cases have spiked. You can see these definitely spikes. And at the moment, United States has also different spikes in terms of their confirmed cases, which might be actually lower than the actual cases. And that might be due to various reasons, testing capacity, reporting data, etc. But you can see overall in all the countries, there has been confirmed cases daily. And even in South Africa, we had confirmed cases reported on a daily basis. If you look at this infographic representation, you can see that this was the weekly confirmed COVID cases over the year period as well. And at the bottom, you can see the more the color intensified, the more the cases are actually represented globally. Particularly in these areas where it's dark blue, you can see that COVID-19 had a significant impact in terms of confirmed cases. In Africa, not so much. We can still see some of the countries is at the lower bottom of the scale in terms of your yellow areas, meaning the case load is quite lowly reported. But in other countries, we can definitely see the significant impact of COVID-19. If we look at Africa, you can also see, according to these color differentiations, that there are different areas in Africa that is not being affected or not being severely affected as the rest of the countries. If you can, for instance, look at South Africa, you can see that we have more than 500,000 cases compared to the rest of Africa. That means South Africa has been affected more in terms of the pandemic looking at the rest of Africa. If we take a closer look across the provinces, and this was also just some statistics that was provided from the 12th of April to the 12th of January, you can also see provincially, this is a representation from the first wave, and in the different provinces, the Western Cape province was the first to actually start peaking in that first wave with Gauteng and obviously KZN and then the Eastern Cape. If we have a closer look further in terms of the plateauing or the decreasing in that wave, that was probably the time period between August and November, and that was where the lockdown measures was put in place and various preventative measures was put in place by our government as well. However, you can see from November onwards to up till where we are now in terms of the second wave, it's been a gradual increase. And again, yeah, quite interesting how the behavior of this virus in the various provinces differs, where the Western Cape was first in the peak, the Eastern Cape was first in the second surge of this virus. And at the moment, as you can see, KwaZulu-Natal and Gauteng province is actually peaking quite dramatically. And as you've seen over the last few weeks, the statistics was varying between 14,000 and 20,000 per day cases that was reported, which is quite significant and concerning in terms of this virus. So let us have a look at what was the impact of COVID-19 on the world. And it had various impacts from economic, food security, education, health, and then obviously the long-term effects. So let's take a closer look. The Lancet report that was published in terms of the COVID-19 Commission statement on the occasion of the 75th session of the UN General Assembly indicated to us in terms of economy that 90% of countries globally are in recession, were in recession in 2020, and that's possibly exceeding the economic downturn during the Great Depression in the 1930s. And this is quite a significant economic statement. The World Bank has said that this crisis highlights the need for urgent action to cushion the pandemic's health and economic consequences, and that we must protect vulnerable populations and set the stage for a lasting recovery. In terms of the impact on poverty, you can see there are two graphs that's represented here. The one on the left-hand side is countries that were largely likely increased to have extreme poverties. And you can see the blue, light blue is pre-COVID, and the dark blue is the statistics that was projected in October 2020. And you can, for instance, see in India that there was a dramatic increase in terms of the poverty that was projected. In figure 2, you can see the long-term effect of COVID-19 on extreme poverty as projected in 2030. And this is actually interesting because you can see that the countries do differ in terms of more African countries versus India, for instance, that was on the first graph significant. So it is important when we look at the impact of COVID-19 on poverty that over longer periods of time, we must realize that poverty will leave permanent scars. Malnutrition will be a real concern in the future. Susceptibility to diseases will definitely increase. The psychological effects linked to all of this. And it is then for this reason that it's useful to look at the longer term impact of COVID-19 on poverty. Taking a look at social security or food security and the impact that COVID had on food security, we can also see a map globally that has been represented here of countries that are at greater risk for domestic shock linked to food security. And as you can see, the darker the color once again, the darker the representation of on the impact of this virus on food security. And the Lancet also highlighted in their paper that hunger is rising and that dire forecast was made that at least up to 132 million people might experience extreme hunger in 2020, as we have seen already, and beyond. In the World Bank report, it said that the primary risks to food security are related to disruptions in food supply, the compromised food production, a loss of income and remittances, and that will create strong tensions and food security risks that we have to be aware going forward, considering the impact of COVID-19 on food security. And as you can see, our realities in South Africa in this picture at the bottom, that is what happened just with school children attending food schemes, people standing in long queues just to receive food parcels. And that was our realities that we had to face in 2020, and I believe still and beyond. If we look at the impact of COVID-19 on education, this is also two pictures in our South African landscape where children have to adapt to new measures, social distancing, masking, temperature checking, health assessments before school. And I'm sure that it will have some effect, long-lasting effect psychologically on children in schools and educational settings. And while that has been going on, we moved to an online platform where children and scholars and other sectors had to actually become aware of technology and how to use that within the education space. But according to the UNESCO monitoring report, they recorded that about 2.5 million learners were affected with the COVID-19 virus on education. This was about 14.6 of the total enrolled learners in their audit. 192 countries were affected, and about 99% of the world's student population were affected by COVID-19 and its impact on education. And we've seen across the globe, including our own country, which is currently also happening, that there was closure of schools, colleges, university sectors, and this caused interruption of students' learning. As I rightfully said, we all had to move very quickly to remote online teaching, which posed its own challenges. There was a disruption in the assessment, and this also caused for trial and error and lots of uncertainty, not only amongst the learners, but also amongst the educators. There was also the great possibility of human capital transfer from parents to children, which has its own challenges in terms of knowledge transfer from parents to children. And then, of course, the effect of homeschooling on parents' productivity and the children's social life and learning is also a consideration. And those were some of the long-term effects that we will have to consider moving forward. In terms of the impact on the health and the healthcare system, this was some of the stats on the 25th of January, and I must say this infographic looked a little bit better than it was in the last few weeks. I think it's for the first time that our caseload reported is actually 4,551. From round about the 16th of December, we saw that our caseload was from 15,000 and up to 20,000 at one stage per day. You can also see the positive cases that was identified to date is about 1.4 million, a total recovery rate of 87.6%. And however, sadly to say that about 41,000 of our country's population have succumbed to COVID-19, and there's still many more deaths, I believe, to be reported. And I want just to highlight the total recoveries of 1.2 million, which I'm going to elaborate in the next slide. But as you can see, this has also had an impact on our healthcare systems. And I think COVID-19 has highlighted the fragility in the healthcare system, the inequalities in terms of resources, in terms of human capital, in terms of equipment resources, in terms of protective personal equipment, in terms of oxygen. I'm sure of lately you've seen that our country, particularly with the second wave, has had reported a supply and demand challenge in terms of oxygen, as our oxygen demands was exceeding the oxygen supply that is actually available within the country. So if we look at the long-term effects of COVID-19, as I've alluded to in the previous slide, that 1.2 million people has recovered from COVID-19. However, and there's a lot of research that is in this area evolving at the moment, and one of the papers in the South African Medical Journal that was published just highlighted some of the extensive impact of COVID-19, and we refer to it as long COVID. And long COVID is actually got an increase in morbidity in the long term and public health implications. And from the studies that has been published to date, there has been reported that people with COVID present about 6 to 8 months later with cardiovascular alterations, chronic fatigue, musculoskeletal pain, anxiety, post-traumatic distress syndrome. And this is quite important because according to the research that was done so far, it is proven that these individuals need rehabilitation, and not only rehabilitation in terms of musculoskeletal rehabilitation, but also psychological rehabilitation, and ultimately what we refer to holistic rehabilitation. And this will definitely have an impact on productivity, organizational performance, outputs, and I think it will be something that human resources and organizations will have to take in considerations in terms of managing the workforce and the human capital, considering the long-term effects of COVID-19. So thus far, we've managed, as you have seen, according to our population stats, to somehow curb the transmission, reduce it, avoid it in some instances. And that was mainly done because we had a COVID-19 prevention toolbox. And in that COVID-19 prevention toolbox, we had things like social distancing of 1.5 meters at least to 2 meters. We had practices that was reinforced in terms of hand hygiene practices, hand sanitizing, hand washing. You heard, according to the new level regulations, that mask is mandatory in South Africa, and the wearing of masks, particularly in the public sector. We've seen that this toolbox advise frequent environmental cleaning, the use of appropriate PPEs, and then, of course, symptom screening, which is very important. And then ultimately, testing and isolation, quarantine settings, and contact tracing was a very important part of this toolbox to actually help with this transmission. But one thing I think the world was missing and was looking for was the addition of vaccines as part of this toolbox. So, what is vaccines and why is it important to be part of this toolbox? So, the aim of vaccines or vaccinations are to eradicate or eliminate diseases. And we've seen this, vaccines has been a long time around. We've seen it in the case of measles, in the case of polio, in the case of whooping cough, and so forth. So we all know that child immunization is a long time practice globally in South Africa as well. So it's important to either eradicate or eliminate those diseases and ultimately prevent morbidity and mortality. In COVID-19, it's important to achieve immunity and to prevent the ongoing transmission of COVID-19, and ultimately to reduce the risk of infection and, of course, to provide personal protection. Immunity or population immunity, as we also refer to, is the indirect protection from an infectious disease, in this case COVID-19, that happens when immunity develops in a population either through vaccination or through previous infection. And you've heard that we need to build up at least 60 to 65 to 70% immunity in our country. So if we look at a vaccine, what should a vaccine look like? And according to the WHO target product profile, it is stated that a vaccine should at least have a 50 to 70% efficacy. It should be safe in terms of the long and the short term. It should also be safe for different age groups, and that includes population like your children, pregnant women, and the elderly. It is highly recommended that a vaccine should be single dosed. However, if it's not possible, it can be 2 doses. And it should be easy to store and to distribute and not require ultra cold storage facility. So these are the important things that should be kept in mind when we look at vaccines and vaccine development. And the WHO further in that document gives a more extensive elaboration on what a vaccine should look like. So how does the COVID messenger RNA vaccines work? The spike protein attached to the human cells, and it allows the virus to enter the cells. But with the vaccines, antibody binds to and block the spike protein on the surface of the virus, and that protects us then from getting infected if SARS-CoV-2 enters the body. And without going more into the pathophysiological or the explanation in terms of how the vaccine works at cellular level, I just want to highlight that your mRNA vaccines do not affect or interact with our DNA in any way. So it does not enter the cell nucleus. And the mRNA vaccines are new, but the technology is not. As I said, mRNA vaccines have been studied for other infections, for instance, influenza, rabies, and your cytomegaloviruses. So it is not new. So what are the types of vaccines? And there are various vaccines and products at the moment that is being researched, but I just want to highlight the four that is probably the most in terms of conversation lines and mentioned in our recent conversations. And the first one is the Pfizer or your BioNTech vaccines. The regulatory body for that is the EUA by the FDA and a number of other countries which have bilateral agreements and including the WHO PQ. The efficacy of this virus is that it offers more than 90% protection. However, it is a two-dose vaccine. And the rollout of this vaccine has happened in a few countries already where bilateral agreements had occurred very early on, as in 2020 already. The storage, however, of this vaccine is that it must be stored in a minus 70 degrees Celsius environment, which is a limitation for South Africa as we have limited commercial ultra-low cold chain storage available. The second one is the AstraZeneca, which is, or the University of Oxford vaccine as it referred to. And this product has been approved by the EUA as well. Efficacy is about 70%. It is a two-dose vaccine as well. And AstraZeneca has already outsourced the production of this vaccine to various sites globally. And the largest vaccine producer globally is currently the Serum Institute of India, referred to as the SII as well. And the SII do not have a presence in South Africa, but it has a local partner, which is Cipla. And this vaccine is likely to be widely used globally due to the temperature stability and the volumes that AstraZeneca committed to through production and through their partners, as well as their tiered price storing module. And the storage of this vaccine is 2 to 8 degrees Celsius. Then we have our Johnson and Johnson vaccine, and the product has not been approved as yet. It is at the moment, I believe, in the final stages, and the dossier submission was expected to be in January, and I think that has been done. And this is a single dose product that is much easier for administration. It's much more cost effective. And this product will be also manufactured at the Aspen facility on a contract basis, which is local. However, this is still in consideration. And we also have the Moderna, and this is also regulated by the EUA. It's two dosage vaccines, but again, it has a limitation because the storage should be at minus 20 degrees Celsius. So having said all of that, if we do have these vaccines available, and you all have heard the recent commentary and the webinar that was done by the Minister of Health, how do we go about in prioritizing who should we give vaccines for and who should we not give vaccines for? So we refer to this as vaccine prioritization, and a lot of papers has already been published on prioritization. There's one paper in the BMJ, for instance, that talks about the global, the regional, and the national estimates of target population sizes for COVID-19 vaccination, and it was a descriptive study and quite a huge study. There was also a paper published by the Lancet that talked about who should be prioritized for COVID-19 vaccines. And then, of course, there was a paper in the Human Vaccines and Immunotherapeutics, and then there's also a COVID-19 vaccination plan for Africa that is available from the Institute for Global Change. And I think all these papers has highlighted how we should prioritize it. And at the bottom, there's just one pictorial that shows there are 3 goals that are highlighted in terms of who should be vaccinated. So what do we do in South Africa? There is a proposed plan that was also sourced by the National Department of Health. And they said that this should happen in 3 phases. The first phase is, of course, when we have limited doses available. The second phase is when there's larger doses available of the vaccine. And the third phase is that when we should have continued vaccination, and then this should shift to routine strategy. At the bottom, you can see the key factors that influence these 3 phases. and what we should be considering as we move along with these phases and prioritizing vaccines in terms of the rollout plan. So who does qualify, for lack of a better description, according to this rollout plan? In the first phase, it is envisaged that all healthcare workers, and this is in all healthcare sectors, will be vaccinated. I think it's for the obvious reasons that we want to protect healthcare workers. We want to make sure that we've got a stable healthcare system with enough people to work and to support patients, whether it is in the first or the second or the third surge of this virus, and to support that. And the target population here is about 1.2 million workers. In the second phase, we look at essential workers, and that can include all your other sectors that are qualified as essential workers. It is also envisaged in this phase to people more than 60 years because they are considered in your vulnerable population that we want to vaccine during this time. Then also people over the age of 18 years old with comorbidities, for instance, diabetes, cardiac impairments, and hypertension. And then in phase 3, we're looking at vaccinating everybody over the age of 18, which will be the rest of the population. And you can see that this vaccine at this point in time is an adult vaccination and not a child vaccination, as we previously has done in South Africa with all these vaccinations that I've mentioned before. So this will be different this time to consider as well. The National Department of Health has also produced a framework for vaccine implementation that will probably assist with this whole rollout plan. And as you can see, your government structure is right on the top, making the decisions, considering it, having the negotiations. And I believe at this point in time, there are lots of conversations in the backdrop taking place with various stakeholders. Then it's also important to communicate this to stakeholders and to provide training. The training has already started as of the 18th of January because the plan is to train as many people as possible to be vaccinators because we need human resources and human capital to vaccinate the population. However, they must be within the scope of practice and they must be trained to do this and found competent to do the vaccinations. In terms of prioritizing the population, that was the first phase that the National Department of Health looked in. Then allocation of the vaccine, distribution, administration. Then, of course, looking at safety, effectiveness, the uptake, and then planning for the dose. They needs to supply, to monitor, to track, to report, and then looking at what is the vaccine uptake, what is the use, what is the coverage. And I think one very important step in this whole process of implementation is then to look at the adverse effects following immunization, often abbreviated as AEFI. And then, of course, to monitor vaccine effectiveness and do the reporting as necessary. And this all happen within the boundaries of regulatory considerations and budget and finance considerations. And as you can see, this is quite an intense process. It needs a lot of deliberations and conversations at various levels to ensure that we do implement vaccines effectively and correctly. So what are the other vaccine considerations that we should be considering? It is important that the perceived vaccine safety is an essential component of the acceptability of vaccines. Vaccine confidence is also important because obviously there might be mistrust from the community. And this can be increased through transparent and effective vaccine safety surveillances and assessments. And then in one of the stages, you've seen that we are looking at your adverse effects following immunizations. And this must be done through an electronic reporting system, which must be developed. And I think around the globe, some countries has already developed it. South Africa is in all of that is happening in the backdrop at the moment. And then there must be an active surveillance and a passive surveillance. Active surveillance mean that everybody must then get a yellow vaccine card once vaccinated. Passive surveillance means that this must be electronically reported, particularly looking at your adverse effects. So there is the medical safety app for electronic reporting that is also in the development stage right now. I said vaccine safety and vaccine acceptability is important. And we've probably seen in all our social media and various papers that vaccine hesitancy or vaccine acceptability is also important to consider. And a global survey on the potential acceptance of COVID-19 vaccines was published in a paper by Jeffrey et al. And as you can see, the countries that was either accepting it or not accepting it varies from 87% to 55%. And in the October 2020 Harris poll that was done, only 58% of the general public said that they would receive a vaccine for COVID-19. And factors weighing on the acceptance, people were asking, what are the side effects? Does it work? How much will it cost? And that was also done and published in a paper by Tyson. The COVID vaccine was also more acceptable, and this was reported in this paper published by Jackson et al. That the healthcare team, people said it would be more acceptable if the healthcare team said it was safe because they trusted the healthcare and the science that was underpinning that. They were said it was more acceptable if there's no cost to the individual, if they could access the vaccine easy, and if the vaccine would help them to get back to school and work and normality and normal life. So that's important to consider. And I think we still have to communicate and produce the right messaging in terms of vaccine uptake and vaccine acceptability. So what can we
Portia,
expect?
sorry, it's a 2-minute call.
Okay. What can we expect if we look at vaccines? And I think this is just important that we have those measures. We look at it before, during, and after what we can expect when we do receive a vaccine. And a vaccine is one measure just to help stop the pandemic, but there are still the prevention toolbox that we must continue to follow. So what is the year ahead? The unknowns is that the pandemic is different across the globe. There's intermittent stay-at-home orders. The questions that we ask is, will people develop lasting immunity? How long will the immune system be protected? Will seasonality affect the spread of the virus? Do we still have to continue with social behavior responses? Do we still have to continue with the prevention toolbox? And we are on the coronavirus pandemic and we have no precedent. So it's an unprecedented time. So those are your unknowns. And this was just a very interesting slide that was published that we talk about the fairy tale, the optimistic and the pessimistic that expect different things in terms of the 2021 scenarios. So what is the year ahead? The known. COVID-19 has brought a change. It points the way forward. It serves as an engine of innovation. And I believe this disruption is in infancy. It's fueled by new technology, including artificial intelligence, quantum computing. It has definitely progressed in renewable sources of energy. E-commerce have erupted and increased under lockdown, and working from home has caused digital explosion. We also have seen modeling consortium scientists, epidemiologists, and researchers having a great opportunity for innovation, creativity, and new discoveries. But we also seen a growth in the knowledge economy. There were sequences of genomes of SARS-CoV done within weeks and shared with the world. There was vaccine development that was done at the speed of light. So maybe after all, the year 2020 is not closed, but offers an opportunity to reflect, to reform, and include our new social contracts that is fit for the 21st century. And the opportunities are endless if we have to rethink what this pandemic has brought allowed us opportunities to rethink our business model, our healthcare and education systems. Maybe we should think about introducing and reinforcing more system thinking and lean management, looking at operational capabilities in terms of cost management, enterprise agility, resilience, and how do we hone and really develop that. Maybe we should look at leadership styles and what is required of the 21st century leader and manager. Looking at our human resources, taking consideration long COVID in terms of talent acquisition, skill development, upskilling people. And then, of course, organizational culture and performance. How does that affect or has been affected by COVID-19? And other innovations like telemedicine might be very important. And COVID-19 has reminded us that we all are so interconnected in this world and around the globe. And as we know, vaccines is but one of the solutions to this problem. And no country is healed or healthy and safe unless we are all safe. And that's important to keep in mind as we go forward. And in the rush to get back to normality in 2020, maybe it's time for us to take the time to reflect on which part of normality is worth rushing back into. Thank you.
Thank you very much, Prof. Portia. I saw that there's some questions coming in the chat box. We will come back later to question and answers. I think you highlight very important issues for us, but I'm convinced that there's many questions. I made a list and we will try to come back to all of that during our question and answer session. Thank you very much.
Yeah.
I'm now going to introduce Dr. Natasha Winkler-Titus. Natasha Winkler-Titus holds a PhD in organizational psychology and is registered with the HPCSA, or the Health Professions Council of South Africa. She currently serves as the president of SIOPSA, which is the Society of Work Psychologists in South Africa, and she also serves as international expert panelist for the Center for Global Inclusion. Following a 25-year career in management consulting and HR leadership, where she held senior management roles with Rio Tinto and KPMG, she consults and is the founder of Signifier, a body of associates aiming to making change significant for individuals and organizations. Natasha is also a full-time faculty member of the University of Stellenbosch Business School. In 2019, she was awarded the Organizational Psychology of Practitioner of the Year Award in South Africa. And in 2018, she also received an award for the best paper at the British Academy of Management annual conference in Bristol in the UK. Natasha, welcome to our community, and we're looking forward to hear your views on Workplace 2021.
Thank you so much, Prof. Renata, for that kind words. And also thank you to our director-elect, Professor Mark Smith, as well as the broader US team for this opportunity to share on this panel and share in this event with you. I want to firstly just echo with Professor Portia that it is definitely my desire that we don't rush back to normal and that we are particular about which parts of normal is it that we would like to rush back to. So in my view, Prof. Renata, it would be such a waste of an immense experience that we had in 2020 if we just want to rush back to normal. I say rather let's take the lessons of 2020 to propel us to greater courage and compassion, and then to embrace these opportunities to not only be better, but also do better for humanity. We are also living in a moment of immense opportunity. And let me just start sharing my screen with you. So we're living in an opportunity of immense moments and happenings. A moment when Kamala Harris, a migrant, a woman of color, just became the president-elect. And let's not forget Elon Musk, a boykie from Pretoria, who just became the wealthiest man on earth, even just for a minute. So Renata, firstly, one thing that I'm taking out here is that in order to achieve great things, you have to leave Pretoria. So I'm very happy that I left Pretoria and joined the USB team. So getting back to the talk for today, What do I have to say about workplace traditions? Firstly, in shaping my perspective on the question we are addressing today, I want to start by conceptualizing these two concepts and how are they evolving. When we consider the concept workplace, I want to highlight three ideas: who works, where do they work, and how do they work? And I specifically want to emphasize remote work because that seems to be something that have exploded and we're all now working from home. And then what do we mean, sorry, what do we mean by workplace traditions? A custom is an established practice or a set of behavior. Typically we say the way we do things around here that is specific to a particular group, a place, or a time. A tradition is a custom that is passed through generations. In organization context, we refer to this as the organizational culture. An organizational culture can have a visible, physical manifestation, but mostly it is embedded in how we perceive, interpret, and make sense of these visible elements. The sense-making, furthermore, is informed by individual norms, experiences, knowledge, as well as our intentions, mostly not seen. Edgar Schein is one of the most prominent thought leaders on organizational culture, and he says that culture lives in the in-between, how people, technology, and processes interface. He highlights that culture is made up of artifacts, espoused values, and assumptions. Artifacts we can see. So for example, if I walk into a building, into an office space, and there are open plan offices, I observed creative pause areas, I see some fun hangout areas, I would be amiss not to assume that this area has an openness in their style, an openness in communication, possibly good engagement, and we could even take a guess and say it might be a happy place to work in. The espoused values is what is written about how we think and we should behave. So in an organization, it would typically be things like your values or your mission statement. Lastly, basic assumptions are those unseen, unwritten rules of engagement. Professor Andrew Thatcher is a prominent work psychologist at Wits, and he said that COVID-19 has changed work, in that there was an increased uptake in remote work and the application of technology for engagement. Furthermore, as shared by Prof. Portia, he emphasized the net loss of jobs. And just in the last quarter in 2020, we saw that net loss spiked to 1.6 million additional jobs that has been lost. And we know that this contributes to the already brutal unemployment crisis in South Africa. Obviously, the main challenge with unemployment is presented in economic and socioeconomic terms. But the challenge is also that we know work serves a greater purpose. Work can provide meaning and purpose, social connectedness, a collective purpose, status, and even structure or routines. Underreported psychological impacts of unemployment includes things like depression, reduced self-esteem, anxiety, panic attacks, community impacts like crime and social degeneration, just to name but a few. So two elements that stands out for me from the lockdown experience centers on the meaning of work and the physical manifestation of culture, especially when we are not in the same building. So getting back to workplace, as I mentioned, who works, where do they work, and how do they work? Much of what was spotlighted last year and what we need to focus on going forward is not new, so we can learn from the past. Firstly, when considering who works, the age-old divide remains, but we are revisiting who is this us versus them, the formal versus informal sector, frontline versus essential, or remote workers. During COVID-19, a renewed focus came to all workers, both in the formal and informal sectors. Now, a Apart from doctors and portion of the medical fraternity, we also noticed that the lower paid workers and those in the frontline or face-to-face jobs shouldered much of the burden in South Africa. And these still very much include women and the previously disadvantaged groups. These groups suddenly became the unsung heroes. Much of these workers, however, do not always form part of the formal labor force. South Africa has a long tradition of work casualization, not always with positive associations. We can refer to Johnson's work exploring outsourcing of services in the higher education sector, including reports from the then Farlam Commission in the 1990s. So labor broking, and then current new trends like flexible labor, the rise of the gig economy, self-employment, and the also famous millennials and their hustles forms a significant part of our informal economy. Now, casualization of work is also positive, and we should encourage it as it holds enormous potential for job creation. Currently, around 2.5 million workers in the casual or informal sector in South Africa, and that represents a sixth of our employed people. It presents greater flexibility, mobility, and for the highest skill, there's greater negotiation power. From a broad-based Black economic empowerment perspective, it should spell greater opportunities for business development and growing the economy. The challenge, however, remains that over and above the good governance we have in South Africa, excellent world-class labor laws, covering even the unemployed, the reality on the ground is that there's little protection for those that are working in the informal sector. Higher levels of uncertainty and opportunity for exploitation remains. A poor psychological contract with no employee engagement is their forte. Therefore, a great opportunity in the workplace is to embrace responsible leadership. How do we do this? Organizational leaders should consider all workers in their operational process through a humanitarian lens. Now, don't get me wrong, this does not imply we have to employ everybody full-time, but rather a level of accountability for human rights and dignity in the context of work. In so doing, for example, supply chain processes where contracting and outsourcing of work happens could include principal stipulations on minimal accepted people practices. Furthermore, beyond practices and processes like corporate social investment, businesses should also have a sustainability and an empowerment strategy that supports the success of individuals beyond their own business success. The World Economic Forum recommends a breakout of the boardroom. So I see a new kind of leader emerging, a leader who pay attention to science, leaders leading with compassion and courage, who are not afraid to consult experts in science, and who act responsibly and takes accountability. A new dimension in the us versus them dynamic now presents a challenge, but also an opportunity for organizations knowing how your employees interpret frontline or essential work versus remote workers. The them versus us divide has now taken a turn and looks slightly different. Probably the biggest conversation remain, how do we work? And specifically with an emphasis on virtual collaboration. Now, why do I use the phrase virtual collaboration? Because it's not only about working remotely or working from home. It is about achieving engagement and collaboration in a virtual space. Virtual collaboration needs to consider job and workplace design, employee and team engagement, work-life flow, as well as achieving engagement and collaboration in a virtual space. It needs to consider the design, employee and team engagement, as well as work-life flow, and an enabling environment for collaborative spaces and practices. For remote working, it also brings greater autonomy and flexibility in work allocation, time, and approach. But the question remains, as echoed by Prof. Portia, are our HR processes and practices suited to accommodate this new way of working. Does the office still matter? This question was quite prominent on a number of platforms during 2020. We have to be careful, though, about giving too much value to remote work studies done during the lockdown. Firstly, this was extremely variable laden and would not necessarily present a consistent pattern of how it could be. Secondly, it was an experiment that very few of us voluntarily signed up for. So in considering the question, does the office still matter? I looked back a little bit before 2020. So in 2019, a study on co-working spaces found a preference for co-work spaces over working from home. The emphasis was on collaboration and a sense of community. Informal chats among workers are essential for mental and physical health. A 2015 study on individual performance has shown that remotely interacting teammates appear to miss the creative benefits that can flow from frequent face-to-face interactions. Therefore, for creativity, face-to-face interaction could be beneficial. A 2017 meta-analysis on burnout symptoms and the office environment found strong evidence for the association between job control and reduced emotional exhaustion, emphasizing autonomy. It furthermore found that low workplace support leads to increased emotional exhaustion. So being in an office space is also not necessarily the answer, especially when it's a toxic environment. It also makes me think, in a time when we are all forced to be behind masks, how comfortable are we with the face-to-face engagement? A 2019 study on employee workplace alignment found a requirement for more segregated workspace was associated with higher susceptibility to distraction. Furthermore, we have a tendency to make assumptions on individual preferences. Example, believing introverts will fare better in isolation. But the individual different factors which moderate satisfaction in the workplace environment have received relatively little attention in past research. So we just don't know. A study published in 2020 explored workplace design and its effect on engagement, collaboration, and perceived performance. And the finding was that there was no direct effect on perceived work performance. However, perceived work performance improves when co-workers are more engaged and have better collaborative capability. So clearly, there is no easy answer. But what should leaders and people practitioners then focus on? Firstly, not everyone is in the same boat. Opportunity should exist for an integrated and engaged on and off-site experience. Designing for a blended approach. The flexible office also plays a significant role in fighting inertia. If employees have no freedom of choice, they can feel stuck in the status quo. People need an ability to collaborate, a sense of community, contained autonomy and support. And most importantly, for those in control to not make stereotypical assumptions. How do you design to achieve this in a physical or virtual realm is the key. Another aspect to focus on is how and where can you get the most focus, productivity, and effectiveness? When are you more productive, at work or at home? So certain tasks and outputs correlate better when you work alone in an environment when you can focus. The rule, however, of whether that space is at home or the office is not generic. Some people, Prof. Renata just shared her picture of her beautiful young 9-month-old. Their situation is completely different to a situation of Natasha sitting in a closed off office with no disruption during the day. So our environments are not exactly the same, and where I can focus better is different to my colleague. And therefore there is no generic rule. Through the lens of social constructionism, we know that working with others can construct new insights, potentially better co-created solutions. But we've also seen that this can effectively be achieved in virtual collaboration. However, technology also brings different dynamics. Things like nonverbal cues, the them versus us problem, etc. I just want to share an anecdote, however. During 2020, much of my counseling work I've been forced to take online. And what I've actually found that, and it's been echoed by a number of my colleagues, even in clinical psychology, is that the counseling process seems to have been mediated a little bit better through the screen. There is something about doing it remotely that gives the person a level of protection. They don't feel as vulnerable, and they are much more comfortable sharing. And they have times when they can take a moment to themselves, when they can mute or turn their video off. So there has been cases where virtual collaboration has been even more effective. So at the end, coming back to our question, why does the office still matter, or does it still matter? My view is that the office doesn't matter. What matters is engaged and effective people, sound and responsible leadership, and the right culture. Location then is influenced by understanding our disruption, facilitating collaboration and engagement, matching output, worker, and location to find the optimal proposition. Our own researchers at USB under Prof. Mias de Klerk found similar trends, and that there are benefits and challenges to working from home. They've also added that employees prefer flexibility and the freedom of alternating location, therefore emphasizing choice. Now, focusing back on workplace tradition, again, I want to highlight that this is not new. Enterprises has functioned across borders and physical locations for decades. I want to give you an example. In my early career, I joined a global management consulting firm. Although we were proudly South African and locally relevant practice, I always felt that I was part of an international business. Apart from the access to international knowledge hubs, global project or development opportunities, there were also little artifacts that made it visible for me. So when I would walk into one of our physical offices, or when I switched on my desktop, on my laptop, the first thing that I would see on my laptop or in the office would be a series of different clocks showing different times in the different time zones where our office is situated. This was a very tangible artifact that just made me walk in and realize I'm part of something bigger. So how may the manifestation of culture and traditions be reimagined post-2020? And is this the new normal? Deloitte, Gartner, and a number of academic research highlights the following priorities. From employee experience to life experience. The flow between work and life has never before been as blurred, and now even more workers are experiencing this, and we must help workers navigate an optimal flow between work and personal life priorities. Unlike the Gen Ys or the millennials, we are now all an always on generation. In 2020, the USB hosted a phenomenal webinar in collaboration with the Ethics Institute, where leading scholars, thought leaders, and responsible leaders contemplated and made sense of the ethical dilemmas coupled with the pandemic. Disruptive technologies also means greater tracking and monitoring. Now, how do you balance that with privacy right? And then also, coupled with that was testing and vaccines, which Prof. Portia just alluded to. Have we considered the ethical and governing considerations? So let me share with you another example. Close to where I live, in the north coast of KwaZulu-Natal, there is a multinational organization. In the heart of the pandemic, they had essential workers on site. It is a 24-hour production environment. And they had half of the employees working from home. Now, in the heart of the pandemic, when there was still so much uncertainty, This organization compelled testing before contractors could come on site. So they have a number of supply chain and contractors that come in and do work for them. And they compel them, when they come on site, to have a medical test done or test clearing them of COVID-19. So in essence, they were withholding job opportunities unless you can produce a certificate. At that point in time, that certificate or that cost, a test, could cost you in the region of 800 Rand a pop. In South Africa, where only 20% of the population has access to medical aid or belongs to a medical aid. Therefore, the complexity of the problems increases and challenges our notion of a culture of trust, creativity, and generosity. A different manifestation of workplace culture also calls for previous culture was felt through engagement, the way people interact and collaborated, and how leadership was practiced and felt. In my previous life, I did a lot of work in the mining sector, and in the mining sector, we would talk about visible felt leadership. And practically what that meant was leaders' diaries were blocked out between morning to about 9 a.m. because it freed them up to walk what we called walk the floor, go down into production site, engage with people. That was visible felt leadership. How do we do those type of things when we are all sitting remotely? How will this felt experience be impacted in the new era? Consider, for example, less spontaneous workplace connections, better flexibility, and virtual collaboration. Then there was also a greater emphasis on well-being and boundaries, for example, caregiving. I want to highlight, however, that although research and my own experience during 2020 has found that, as I shared, a process of counseling, like counseling, actually had a positive experience that was reported for online counseling engagement. Furthermore, we all know that communication is complex. We think that when we spit out a few words in a language that we are busy communicating, but in essence, it's not. Communication is so much more. It is about relaying a message, and relaying a message means you are aiming for something. You've got an intent. You want to shift somebody's understanding, their meaning, or their interpretation, and you want to shift their behavior. So what I've also found is with communication, there are opportunities that comes with technology. It is not just about calling a meeting. We now have the opportunity to think about what is it that I want to communicate and what is the best means. If I just want to share information, I can use an email. If I want to truly engage and get feedback, it's nice to do a Zoom call with small group discussions. There's shared spaces that we can, like Teams or Google spaces where we can share things. So the virtual space also gives us opportunity to reimagine communicating and provide opportunities for greater meaning and engagement. We then also need to think, what do we value? To make change happen, we need to be thoughtful and intentional about how human needs and systems interact, how we coexist with the technologies we increasingly integrate into our lives. As we rely upon and incorporate new tools and insights, and we should, we also need to take the time to think about our purpose and what we reserve for human beings, not to avoid the technology, but to build them to better serve us. These technologies can bring flexibility, equity, and efficiency that we so sorely need. And in all that, to keep in mind that human beings shouldn't just be in the loop, we are the loop. The notion of work-life balance has been turned on its head, and continuous focus on work-life integration is important. The meaning of work and psychological contract is not new, but as it relates to COVID and the new era that we were working toward to, we find ourselves in situations that has also shone the light on how we think about the concept of organization and organization behavior. Too much focus still looks at organization as a static thing, sometimes brick and mortar, but basically a structure and a system with boundaries. We need to reimagine the design of organizations or organizing centered around purpose and a living system connected to the broader institutional and ecosystem. According to a recent report by the World Economic Forum, COVID-19 has reminded humans how dependent we are on ecosystems and the acute connection between human health and our planet's health. What we see now is an opportunity to reflect, to reevaluate and reimagine the ways in which we use our resources. In a post-pandemic world, concern for our health and the health of the planet has grown, and with it, willingness from leaders across the world to support sustainable systems and materials that sync with nature. As a work psychologist, I specifically observed a renewed focus in business on employee health and mental wellness. The South African Depression and Anxiety Group reported that the numbers in need of counseling quadrupled during lockdown. Now, when we talk about mental health, we are not talking about the DSM levels that Renata in her psychiatry practice deal with. We are talking about stress, anxiety, and basic issues of coping behaviors and coping mechanism for the normal person in everyday functioning. If we reflect back for a moment, past studies have shown, if we take the example of Hurricane Katrina, a study has shown that Hurricane Katrina had above baseline stress and depression systems a year after the event, indicating that mental health problems may remain long after a crisis. The difference with this study is that Hurricane Katrina was a crisis that was complicated. Our situation is complex and there's still much uncertainty. We have just nearly completed a full year of disruption, and then 2021 did not start with any more certainty. In conclusion, workplace traditions must be reimagined toward the greater good of humanity. The workplace is an expanding concept, and Professor Theo Veldsman reminds us to get beyond organization and embrace future-fit ideas of organizing around people and purpose. Who is working should become the concern of everyone. Virtual collaboration can hold immense benefits if applied correctly, ensuring technology and psychology is in balance. Let us not rush back to the old ideas of normal. Rather, let us use this crisis to propel us to greater courage, compassion, and significance, to reimagine work, the worker, and the idea of organizing around purpose. I thank you for the gift of listening.
Sure, Natasha, thank you. I've also followed the comments here, but obviously you touched some things that's very dear to me and very important for me as well. Our timing is perfect. So it is now time for question and answers. I think what I will do is I will start with the questions that already has been posed in the chat, and then we can take it from there. I will be posing questions to both Portia and Natasha, and I will also try to keep it balanced. But feel free, if you want to ask a question, the easiest might be to put it in the chat, or I will also try to monitor the raise your hand function if you want to use that, and then we will call on people with questions. Portia, maybe something for you first. One of the questions that came up, if a person had previously contracted COVID, has recovered, and technically now has immunity for at least 3 months, they say, if it's the correct or the same strain, should they still get vaccinated?
Yeah, thank you, Riata, for that question. I think when people recover from viral infections, for instance, measles, mumps, or even anything else, they are protected against reinfection and would probably not need to be vaccinated. And that's our vaccine history. However, with COVID, we don't know what the vaccine protection is. At this point in time, there's a lot of studies and research underway from various organizations. So The safest would be, as we do not know this unprecedented novel virus, that they should be or vaccinated because they might be reinfected. Even currently in South Africa, as we've got a new variant, we don't know how that variant will affect the behavior of the virus and how it will affect the vaccine. So definitely vaccination is important. Thank you.
Portia, something else that links with it. Other vaccines or childhood vaccines is considered compulsory when you enroll for a school, etc. We know now that we are going to vaccinate adults, but what is the ethical implications and the practical implications when you have someone that refuses the vaccine? Say, for example, you're in an organization, most of your employers get the vaccine, but if one person don't get the vaccine and they would contract COVID, and then there's isolation and all that implications, would there ever be a compulsory vaccine for us as citizens?
I think at this stage, because the safety of all these vaccines that are being produced at this stage is still very much under investigation. And as I indicated, there's vaccine hesitancy. There's also vaccine deniers at this time and vaccine refusers. So I think it is a human right, particularly in the adult population, because COVID-19 vaccines will be an adult vaccination at this stage, that people will have the right to say they don't want to be vaccinated. But obviously, as I also alluded, vaccination goes hand in hand with the prevention toolbox, and it will be the responsibility of the individual to keep to those prevention measures and the social distancing and the masking, and then take the responsibility to protect themselves until such a time that we have enough herd immunity to protect the rest of the population.
You mentioned now herd immunity. If I made my calculations, even after phase 3, we will only have 22.5 million people infected, vaccinated, sorry. And then we look at the vaccination rate. Now that is bringing us way, way below 40% of the population still. So when will we actually achieve herd immunity, and how long will we have the other measures? Shouldn't we then encourage people to get vaccinated even more? Or isn't it good that you contract maybe mild COVID to get your immunity up?
Yeah, so it is important. I think on the one hand side, we want to encourage vaccination as an overall goal. However, as we all know, there is vaccine nationalism. We are in a situation in South Africa where we have to purchase vaccines, where we have to distribute it. So I think in the other sense, we're looking at availability of vaccines and distribution of vaccines, and there is a whole process of implementation linked to that. So we still got a long way, I think, and some of the targets might not be as realistic as possible, looking at how we need to implement this. And herd immunity is definitely something that can either be achieved by vaccination or by exposure to infection. So as time goes on, I think those things will have to be monitored. It have to be, definite studies have to be done. We have to see how the population reacts to the vaccines, to what type of vaccines. So Renata, is a very difficult question because at this point in time, until we start with vaccination in the country and the vaccination rollout plan, those are still the uncertain questions that we will have to unfold as the year also goes by. Thank you.
Thank you, Portia. Natasha, there was a few comments coming in and opposite views where some people said, like working from home and the flexibility was the death of office politics. So it really improves things for us. While others have said that due to the nature of their business, inequity has significantly increased with working from home. This varied experiences make me wonder about, do you have any suggestions for us how organizations can leverage and improve virtual collaboration to not create office politics, but office connections, and to make sure that someone doesn't stay behind?
Thank you very much, Prof. Renata. Yes, it is a very good question. So let me first start with, first of all, an organizational culture that was toxic before 2020 is not going to become better because everybody's suddenly not facing each other. They're not around the same, as they say, the water cooler talk. Okay. So if you had a strong, vibrant, healthy, engaging culture, it is very easy to move that onto a virtual space. If you had a toxic culture, you will still see much of that perpetuated in a virtual space. It could be a need for, you know, the kids talk about fear of missing out, for FOMO, a need for, and you will find managers needing constant meetings, 100 meetings to check up on people. Last night we had this discussion with a few friends where one organization pretty much give their people autonomy. They work from home, they give autonomy, while another organization don't even allow you to be in the shop during working hours. So from a virtual collaboration space, the culture that exists, and cultures are often influenced and inspired by the leadership style and then the processes and practice in place. So leaders need to think carefully and really be determined around what it is they want to create. From a virtual collaboration point of view, as I mentioned, we are also noticing a new dimension around the them versus us. The them versus us used to be managed versus employees, knowledge workers versus frontline workers, blue collar versus white collar. Now it is about the frontline or essential services versus those that can work from home. And there can be feelings there as well. Working from home does not necessarily come with a feeling or perception of privilege. Some people might feel left behind. They might feel those that are at the office are being noticed, are being part of the team. So there's a new dynamic in the them versus us. So we have to get close to what people's perceptions are, how do we manage those perceptions and address and close the them versus us. There's also elements of people in the front line feeling that they are exposed and that they are in the firing line and that they are not appreciated. Virtual collaboration, as I said, not everybody's in the same boat. So organizations need to think carefully. And I saw a lot of work in organizations last year around that, in setting people up. Working from home is not always the ideal and the preferred preference for everybody. We've also seen the trend, and there is studies and there's a lot of statistics, and Prof. Anita in her women's report also highlighted the imbalance of the impact on women that the lockdown has had. Most of women work in the front line or in these essential positions. And then also working from home, women has additional responsibilities. So suddenly you became a tutor, you became a taxi, you became everything, not only an employee. So we are not all in the same space. Not everybody has got 5G and backup and a light in front of you and a lovely, perfect little office that you can shut the door. I've seen people literally sitting on their beds having to work. So those are all the dynamics. Companies have to ensure they equip and empower people for whatever situation they are working in. But I also just want to share, as a supporter of virtual collaboration, I have also experienced immense success stories and great opportunities that virtual collaboration has brought to us during 2020, which we really need to leverage on going forward.
Yeah, I think what is very important that you also mentioned, Dr. Natasha, earlier is in terms of not assuming and making statements what work for people like introvert, extrovert, whatever. In my practice, I've also seen patients that you think will struggle, how they really blossomed with Zoom consultations, which is not usually the case, and the opposite, that people really intensely dislike it. I have a question that's maybe touching on both Prof. Portia and Dr. Natasha, which you can maybe both address. We talk now about stress, we talk about mental health, but I've seen in my practice specifically, but also amongst colleagues and friends, the impact of the toolbox that Prof. Portia mentioned, the non-vaccine strategies that we have, masks, social distancing, etc., how much conflict, not necessarily overt conflict, it can create, but also psychological conflict and discomfort, where some colleagues adhere to the rules, some friends adhere to the rules, and others not, and you're expected to be at work. What is your views on how workplaces can address this better to create a physical and psychological safe space for the employees?
So maybe if I can jump in there quickly, we saw this trend quite a lot toward the end of or the third quarter last year, where some of the restrictions were lessened and things opened up, and organizations were starting to prepare the return for work. One of the biggest challenges at that time that I found was the emphasis on the physical and biological health. So making sure there's sanitization stations, making sure there's closed off work desks covered with a screen, making sure we have the equipment that people need. What organizations were not paying attention to was the psychological impact of returning to work, because you are not returning to the environment that you left. You are returning to an environment where you could not have physical contact with your colleagues, where you have to talk behind a mask, where you have to continuously sanitize, where there's restrictions and rules. And that had a negative effect on people's psyche, to such an extent that we also saw more people and more organizations pulling back and saying, you know, if it's not essential to come to the office space, that people should continue working from home. I personally have experienced it, so I don't go out a lot. I do not socialize a lot because I cannot speak behind a mask. I absolutely physically hate speaking behind a mask. So most of my engagement in 2020 has been extremely effective through Zoom, because we could see each other, we can talk to each other face to face. So the toolbox is essential, but the way people apply it. And then the last thing I want to emphasize is, from a legislative point of view, and I don't want to comment too much because I'm not an employee relations expert and an expert on labor law, but how you enforce these rules will also become a contentious issue. As we know from a psychological point of view, and neuroscience have taught us, there's certain things, basic things that all humans want. And a perception of fairness sits at the heart of what all of us want. So when we are observing unfairness in how people are treated, some people are allowed to engage without their masks on, while others are enforced to keep it on, will create a perception of disconnect and a them and us again. So organizations need to think carefully about not just how do we enforce the rules, but also how do we come across and create a perception of fairness for all people.
Prof. Portia?
Yes, thank you, Renata, and thank you, Natasha, for that. I couldn't agree more. And I think it's so important because we're all human beings. We like sociability, we like to interact. And I think coming back to a workspace where interaction is so important for human beings, and some human beings thrive more on it than others, it might be very difficult to go into that space of constantly sanitizing, washing your hands, wearing a mask. However, I think the messaging is so important, not to the employees only, but to the whole community out there, because we've seen when these measures in those toolbox that I mentioned have been applied successfully and consistently, how actually it flattened our curve throughout this pandemic. And it's so important that that messaging is done with sincere empathy, that we explain it, that we are aware of people's needs and have the sensitivity for that, and just show them the impact of applying the correct mask, for instance, to wash your hands properly, because that is how the virus moves. These viruses are, or especially with the new variant, which is much more transmissible and infectious. It's important that people understand the rationale for doing this. And although it is a period where it might be very difficult for employers and the community to adhere to these social measures and the prevention toolbox measures, we need to get the message out there that this is important for the season that we're in until we can get the vaccinations and the herd immunity. And even if the vaccinations as part of this is implemented, we still have to continue that as part of curbing the transmission of this virus. So I do think communication strategies are extremely important. And even if those inconsistencies practices does occur within organizations, is to have the conversation up front and say, because the social behavior of people has also been a very important component in driving this virus or reducing it or flattening the curve. And I think that's the message that we must get out there. Thank you.
So, Prof. Portia, realistically speaking, we are looking at wearing masks, sanitizing as part of our daily life for at least another 2, even 3 years, realistically speaking, if we think of a third and fourth wave and the vaccine rollout plan. Now, there was some comments about the recent move where the general public initially was encouraged to wear cloth masks, that they are also now wearing more surgical masks. Any comments or advice there?
The cloth mask is still the way to go. And I think there is also on your WHO website, definite criteria of what this mask should do. But I think the most important is that you should wear a mask that covers the nose and the mouth. And I think that's also the messaging that's important, because if you look at your PCR testing that is done, we take a nasopharyngeal or oropharyngeal or both swabs. And what we don't know, what the public often don't perceive as correct, is that this virus occurs either in the nose, the growth occurs there, or in the mouth. So if you don't wear the mask correctly, that is what you're exposing other people around you too. So I think the bottom line is lots of people has been buying surgical masks and N95 masks and masks with filters and all of those kind of things. But the bottom line is wear your mask correctly. And if you do have a cloth mask, wash it appropriately and immediately after exposure. Hang it up in the sun. And those are basic public health measures. Those are the things that are important. And wearing surgical masks, immediately dispose it, take in consideration the safety measures in terms of our global health, etc. So that is the bottom line, I think. And people sometimes often go to either the extreme of not wearing masks or the other point of the extreme of wearing masks that are absolutely providing overprotection that is not necessary in the public domain. Thank you.
Thank you. Roxanne asked, how do we create confidence around the vaccine through transparency when we ourselves do not yet know the long-term side effects and safety statistics? Yesterday, we as healthcare workers had eventually the opportunity to register ourselves and our practice staff for the vaccine, to at least they're now trying to establish how many we are that needs vaccination. And I'm sitting with a staff member that doesn't want the vaccine, which creates difficulties for us being frontline. And then one staff member that asked me, you see all these things on Facebook going around and people are scared of the long-term side effects and will we grow tails or horns or whatever the case might be. And what is my thoughts about it? And my standard reply at this stage is, as soon as it's available, I will take it. But surely there must be a better conversation that I can have with people. Prof. Portia, what is the simplest way that we can create confidence in the vaccine? And also perhaps, should we be scared of long-term side effects?
Yeah, Renata, thank you. I think for all vaccines, if you look at measles, polio, whooping cough, rubella, all of those vaccines do have the potential for side effects. The studies that were done up to date for the COVID-19 vaccines has certainly also shown minor side effects. So I think it is a natural causation that vaccines will cause side effects, whether you take it, even a tetanus shot actually do cause some side effects. So I think people must understand that there will be some kind of exposure. The worst side effects that was reported in one study was actually anaphylactic shock. And that's why the new rollout plan in one of those strategies is actually saying that if a vaccination is taken, then you must report your comorbidities. It is important to report whether you have previous allergies or whether you are allergic to anything, so that that vaccine is then administered under medical supervision or in a medical facility. So I think people need to be aware of what can happen, what is your predisposition to allergic reactions, and that will determine where these vaccines can then be administered. That's the one thing. The second thing, I think, again, and in the communication or in the rollout plan, communication is one of the strategies that the Department of Health nationally is working on at the moment. And having a communication team to actually engage with the public in saying, these are the vaccines that we are purchasing, these are the side effects, this is what it can possibly do, these are the benefits of having a vaccine, and constantly having those open communication messaging will be very important going forward. It is still very early days within our own South African context until we have vaccinated and monitored, and particularly has started with the adverse effects following an immunization program. It will be important to monitor what are the side effects of these vaccines within a South African context, also considering having new variants that were emerging from the COVID-19 virus at the moment. Thanks, Leota.
Thank you. Dr. Natasha, one thing that I picked up, you mentioned in your talk psychological contract. Can you tell us more what you mean by that, and also how you see it as being reimagined in 2021 and going forward?
Renata, you're putting me on the spot because this is the one area where we need research on from an organizational behavior perspective, and we are busy with that research, so give us a few more months and we'll publish it. Psychological contract, in essence, is what do I contract with you as my employer? We are all very focused on the contract of employment, which stipulates your rights and your the rights between the employer and the employee, what you will do in a relation to certain things, and what do you expect in return for that. So we all know what a formal contract of employment is. A psychological contract is my intent and my values. It's often unsaid or unheard or unseen. What are my intentions? What are my value system? Why do I join this organization? I come to USB because there's an ethos of responsible leadership that speaks into something about me around significance that says, I want to be part of that. So it's nowhere written in my, no, sorry, I'm lying. In that USB, we do actually have a contract that says we will make a social impact. But usually it is an understanding. It is an understanding between the person I report to and myself around how do we work, how do we engage, what is the trust between us. So a psychological contract is expectations from both parties that are not necessarily written down. This was always very visible in a physical work domain by building rapport, getting to know people, building up trust, having expectations, getting to know what works for certain people, and then adapting your style to that. In a physical space, we were able to do that because we work in close proximity. We spend unofficial time together, so the water cooler talks, the coffee chats in the morning. Going forward, and it's not just about virtuality, It is about a new dimension of work. And as I said, organizing around purpose is, how do we build that psychological contract? What are the new expectations? What does meaningful work mean for people that work for you? So going forward, our challenge is not only about building psychological contract in a virtual way. I started with the USB heavily, like Professor Mark, during lockdown, have physically met very few people, but I've already got a few established relationships. I've collaborated on projects and initiatives, but it all had to be done in a virtual space. So we need to do research around not only how do we build a rapport and relationship and a psychological contract in a virtual space, but also in a new expectation of what it means to be human, how my work life and my personal life flow. In the past, we talk about work-life balance, but I think we're beyond balance. It's about flow. Our lives are integrated. It is about a new expectation from the organization. As I mentioned, there was an uptake of mental health and mental health awareness from an organizational context. We are still extremely underreported in South Africa around people disclosing their stress, their anxiety, all of those type of things. We saw definitely in 2020 a greater uptake by business that mental health and wellness is important. So how does that play into my psychological contract with the organization, with my boss? A new way of being. As I said, the them versus us is looking different to how we used to describe it. And I think, Renata, probably something that sits at the core of me and what I believe in is the divide between the formal and the informal sector. I think we are too focused when we think about work. It is still very much about organizations. It's within structures. Most of the research and the work as far as work is concerned happens in that space. Very little attention is given to the informal sector, yet they are also workers, they also have dynamics, they also have needs, they fit in somehow in the system. And so all of that makes up the new world of work, and we have to redefine a psychological contract in this new world of work. So the SIOPSA, the Industrial Psychology Society, is currently busy with a project around and we looked at the fourth industrial revolution, but I think we can add the pandemic as a dynamic, but as a cursor for shifting us into a new way of being as humanity and what that means for the world of work. And we looked at it from an organizational psychology lens and what that means. So we are definitely busy in research redefining that as we speak.
Thank you very much. This brings us to the end of this morning. Some thank yous. Firstly, to Prof. Portia and Dr. Natasha for sharing your very valuable input. And I think you address things that's very relevant to us and very much our reality. As I mentioned initially, maybe we should talk about 2021 as the new reality, not the new normal, but our reality in which things will become normal. I want to thank marketing, specifically Amber, Adwa, and Paula, for putting the morning together, and then for all attendees. Without you, there would have been no event. I want to leave you with a thought. We often think, what can I do? Does my mask make a difference? Does my sanitizing my hands make a difference? Or does it help if I don't go to the mall, but everyone else go to the mall? At the same time, we question ourselves. How well do I do with this working from home? Am I doing a good enough job? Am I managing the technology well enough? And do my line managers think I'm lazy, or whatever the case might be? So my wish for you is to just reflect that we wouldn't plant a seed and then dig it up every few minutes to see if it has grown. So why do we keep questioning ourselves at this time and our work and our decisions and the small acts that we can do now to make 2021 and the years to come better for all of us? Have patience, stop overthinking, and keep watering your little seeds. Your small acts, if we all put it together, make a huge difference. Enjoy the rest of your morning and also the year ahead. Thank you, everyone.